Okay, so let us talk today about one of the conditions which is very common nowadays, and that is male breast or gynecomastia. And especially, we'll talk about how homeopathy can help in this type of condition. First, let's try to understand what gynecomastia is. So, gynecomastia is an endocrine systemic disorder in which there is an increased swelling or increase in size of the breast tissue, especially in males. And you can see a image of this here typically, and you can see a picture here where due to the hormonal imbalance there's a slight swelling of the male breast. It's very difficult to actually clearly say what is the causes of it. There are many genetic causes, but one of the commonest causes is hormonal imbalance, and even people who are having liver, kidney, and testosterone imbalances, certain drugs, certain liver problems can cause it. You can see one of the pictures here. There are certain allopathic medications also, like ketoconazole, cimetidine, gonadotrophic releasing hormone analogs, and certain other estrogenic or hormone related tablets that can actually cause gynecomastia. It's been classified into few parts. Grade 1, where there is a minor enlargement, no skin excess. Grade 2, no skin excess, moderate enlargement. Grade 3, moderate enlargement with skin excess. And grade 4, marked enlargement. Typically, one of the main sign and symptom is a kind of a soft, compressible, mobile subcutaneous tissue swelling, and there is a dimpling and nipple retraction. In some cases, milk discharge may be found. In some cases, no. One of the ways to diagnose it is actually by examination and looking at the other sexual characteristics. Mammography is one of the tests to check it. Some people also do certain kind of FNAC. One of the treatment is surgery. Certain medications are known, but I want to talk to you about how homeopathy can help. Because in homeopathy, we try to understand and we try to go more in depth and try to understand the deeper state within. And we have seen often that stress, lifestyle, and hormonal imbalance can be one of the major causes of gynecomastia. And it's often related to the lot of stress and deeper state, deeper pattern within. So I want to give you one of the case examples which I saw recently. And this is a case of a 16-year-old male child who had this kind of swelling, almost like a big swelling on his left side of the chest. It was diagnosed as male breast gynecomastia, and the allopathic doctor suggested certain medications. But even with those medication, it was not improving, and that's when they saw me. Mainly, this kind of disorder can cause a lot of psychological imbalance. So there is a lot of embarrassment, and he has been putting on weight. So it was a lot of stress and a lot of shame, guilt feeling within. You can imagine with the peer group pressure how it must be for a male child to develop this kind of swelling. In homeopathy, we try to understand the state of mind and try to go much deeper. About him as a person, he is very cheerful, happy, and he likes to be with people. But he doesn't like to be alone, and he feels more safe and protected with his family members. One of his favorite things is to travel, and he likes to be on his own. He likes to wander, do things on his own. He gets scared very easily, and his biggest fears is of being alone, of animals, injury. One of his main dreams is of animals, and he feels very, very terrified when he looks at animals. He feels very chilly. He's affected by cold weather. He likes meat, sweets. His sleep is quite comfortable. He sleeps on his back. He sweats a lot. So when we analyze this, we try to find peculiarities, and one of the ways to find peculiarities is to use a homeopathic literature, the repertory. So when I looked at the one of the repertories as Kent repertory, you could see that the tumor in the mammary on the left side in male mammary, there is only one remedy, that's calc-phos. And when we understand calc-phos, the main feeling in calc-phos is the need to go out to meet more people, to find love outside their house, and the idea that they feel very, very insecure when not given enough attachment and a lot of fears. So the remedy we gave is Calpfos 200, and I repeated it quite often. And it's a follow up after 3 months where the gynecomastia almost went away by 90%. The swelling has gone away totally. His hormonal imbalance has improved, his weight has improved, and he feels much confident and positive about things. You can imagine what kind of stress a male child would go through with this condition. So, this I wanted to talk to you. This is my email ID. If you want to write to me about your case with this kind of problems or any hormonal problems, you can write to me. It's my clinic address in Mumbai, Dadar. Skype ID if you want me to do any online cases.